Hi, my name is Lily Holland. I'll be doing my immediate care newborn assessment video today. Before I get started, I'll be sure to follow my GPSPs. So I just had this baby handed to me from a doctor. The first thing I'm going to do is I'm going to facilitate drainage, make sure that their head is turned, and use a bulb syringe to suction their mouth, then their nose. And then once I've done that, I'm going to stimulate the baby very well by drying. I'm going to dry quickly, make sure that they're completely dried off. And then once I've done that, I will take my wet linens and dispose, and then put them on dry linens and make sure that my radiant warmer is on to keep the baby warm during the assessment. So then I'm going to do my APGAR assessment. So you need to do an APGAR at the first minute of life and then again at 5 minutes. Normal score is around 7 to 10. So I'm going to assess the appearance. She's got pink skin. No sign of acrocyanosis, which is bluing of the toes or the fingers or around the mouth. And then I'm going to do the pulse. I'm going to listen to an apical pulse for 1 minute. And while listening, the pulse should be between 110 and 160. And then I'm going to do grimace. I'm going to, by assessing reflex irritability, and I did this already by suctioning, but you can also tap the bottom of the baby's foot, and if they like flex up, then that's their grimace. And then I will do their activity. So I'm going to assess their muscle tone, make sure that they're moving their limbs, and make sure that they're in that flex position. And then I'll do their respiratory effort. Make sure that their chest is rising and falling evenly, they have unlabored breaths, and they're even and counting respiratory rate. After I've done that, I will assess the umbilical cord. So the umbilical cord should be clamped at this time. Make sure that there's no bleeding and make sure that there's 2 arteries and 1 vein. Then I will get vital signs. So I will do an auxiliary temperature, get a blood pressure, make sure that the cuff is appropriate size, check their heart rate and their respirations. After I do that, I will do their head to toe assessment. So I'm going to sit the baby up, feel their anterior and posterior fontanelles, make sure that there's no molding, assess for molding and a cephalohematoma. And with their fontanelles, I'm going to make sure that they're not bulging or that they're sunken in, and make sure that they're flat. Once I've done that, then I'll check their organelles and assess their hip mobility. And then I'll do my 3 reflexes. I can have the baby grasp my fingers and make sure that they're gripping on for a reflex. And then I can sit them up and make sure that their head is not lagging. And then I can test the sucking reflex and putting my finger in their mouth, making sure that they're sucking. And then after I've done that, I will ensure that the baby has a bracelet on and an identification bracelet on, and that mom has one too. And I will make sure that required prints are done on their feet and their hands. After I've done that, then I will measure the baby. So I'm going to take my tape measure and measure from the top of the head to their feet. And she's about 45 centimeters. Then I'm going to measure circumference of the head. And that is about 31. And then I'm going to measure the chest right at the nipple line. And that is 28. So once I've measured, I will then weigh the baby. So I'll pick the baby up, zero the scale, and place the baby on the scale, keeping my hand over the baby, making sure that they don't fall off. The baby can be around 7 pounds. Once I've done that, then I will clean their eyes with a moist cotton ball, going from inner to outer. Another cotton ball going from inner to outer, then applying my prophylactic ointment in the lower conjunctival sac on both eyes. And then I will prep the vastus lateralis for the vitamin K shot. So I'll get alcohol swab and get my vitamin K injection and insert. And once I've given the injection, then I will dispose in the sharps. And once that's done, I put a Band-Aid over it, and I would put a diaper on the baby and swaddle the baby and give it back to mom and document and immediately.